Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Arizona. Welcome to another Ask the Expert show where we bring you, for the last 16 years, all the top experts in the field of legal, health, financial, and home improvement. There is a topic that is, I don't know, I've been doing this for 16 years, and for about the last year has become one of the hottest health topics. It's called neuropathy, and it is really difficult to find a doctor who really specializes in that area. And folks, listen, you might not know you've got neuropathy, and you've got to get it treated. And we're going to tell you everything that you need to do. And it's going to be coming from, like I said, one of the top doctors in the Arizona area. Let me welcome our expert, Dr. Patrick Sars. Good afternoon, Dr. Sars.
Good afternoon, Steve.
I think what you're doing is amazing. Your story is absolutely what got you started with neuropathy. And let's start there.
Well, I got interested in it primarily due to the fact my mother suffered with it.
Yes.
That, according to the Mayo Clinic here in Scottsdale, that on a podcast they did, that the neurologist spoke that there's about 200 different things that can cause neuropathy. Now that's an increase of about 100 from the time I started, because in 2008 they just said there was 100 things. My mother's neuropathy, we believe, was from DDT, which was a herbicide pesticide that we used a lot back in the 60s. I grew up on a cattle ranch and dryland wheat farm in eastern Montana. We didn't necessarily always take the precautions with this stuff, that back in the 60s, basically it killed weeds and bugs, it won't hurt me mentality. And my mom had gotten drenched with it one day and didn't clean up until that evening. Numbness started in her feet a few weeks after that and just progressed throughout the years. I was about 12 when it started. By the time that I started chiropractic college in my late 20s, my mom was already fully confined to a wheelchair. Great deal of pain. When I graduated in 86, I started trying to find something to help her. Unfortunately, I never did. Both my parents passed away in 1999, but we found some things in 2008 that showed some promise, in 2006 that showed promise. We started treating patients in the office in 2008, and our program basically has evolved over the last 17 years to the point now that in the last 5.5 years of the patients that I've accepted, 98% of my patients have responded to what we do with at least a 65% reduction in their symptoms. Most of them get a lot more than that, but it is not a curable disease. It is a secondary disease. So it is something that you need to continue to keep doing for the rest of your life as far as this treatment goes, to maintain it so it doesn't come back. But we are very successful in being able to do that.
Dr. Sars, why do you think that people don't get this treated? I mean, even if you don't know what neuropathy is, there's so many symptoms that people have. Why do you think they don't get it treated?
Primarily due to the fact that they're told that nothing can be done. And they will go to their family doctor. Their family doctor might be able to ascertain that it is neuropathy, give them a medication, gabapentin, pregabalin, the like. But they'll tell them that basically that there's nothing that can be done for the neuropathy. They just have to learn to live with it. And that's primarily a precursor of how our medical establishment is set up today. I don't mean to sound cynical, but in all actuality, pharmaceutical companies have a large degree on how we actually treat diseases. And we have, as far as having an acute problem, if you have a heart attack or something this way, we have one of the best medical healthcare systems in the world to deal with that. When we start dealing with chronic problems where we're that we actually need to see if we can actually regenerate something and work from that aspect, we're limited from that. And there are things that actually can be done. That the most definitive way to test neuropathy is actually doing a biopsy where they take 2 or 3 plugs of skin from lower leg and the feet, stain it, and count the number of nerve endings. We did some pre and post on patients back in 2010 that we were successful with, and showed that we could actually increase the nerve density by over 400%. So we can actually get the nerves to regenerate. The problem is keeping it that way. And that's where the real problem has always been, is that people don't understand that this is a long-term commitment to treating this problem. Don't necessarily like to use this analogy because I'm not really that much into advocate of using medications, but if you have high blood pressure, you can take medication and you can get high blood pressure under control. It doesn't cure the high blood pressure. It just control. And that's what the treatments for neuropathy that we do is that it gets it under control, reverses it so that basically you don't have to treat it as much, and you can maintain it so that you can actually live a neuropathy-free life. The medications they give for neuropathy just mask the symptoms and eventually it's going to get to the point where that medication is not going to work and neuropathy is just going to always be present.
Well, I am going to make a bold statement. Dr. Sarge, you're going to hate me for saying this, but I'm telling you, and hey, listen, I might be off, but I'm telling you, I've done enough of these shows. Dr. Sarge probably knows more about neuropathy than anybody in the Arizona area. You've been studying it, you've been treating it for so long. And listen, if there's a chance of getting any kind of, like you said, you can't, it's not a cure for life, but any kind of relief, it's Dr. Sarge. Dr. Sarge, so there's people listening to the show right now, and they're going, well, how do I know if I might have neuropathy?
Give you a couple simple things to do. Neuropathy affects the sensory nerves in the very beginning. Okay. And so what will end up happening is that you'll lose the ability to feel some of these sensations. Easiest way to kind of test that, and it works the vast majority of the time, but we have a number of nerve endings carry different sensations. So these two might not be involved, but the nerve that carries the sensation of cool, get a metal handled knife, like from a flatware set, take your off and have a bare foot, touch the metal handle to the forehead so you know how cool it is, and then touch the top of your foot and the top of your toes. It should feel the same. If there's a diminishment, then that's an indication that they're starting to have some problems with the nerves. Taking a hair dryer and just placing it on warm with low fan, but we're not trying to burn you. We just want it to be warm. Do the same thing. Blow it on your forehead so you feel the heat, and then the top of your foot, and the top of your toes. If there's a difference, that could very well be the beginning of having neuropathy. And it is something then that give me a call and get in, and we'll actually ascertain whether or not that is what you're dealing with.
And it really, because we've had people who've written into the show before, talk about loss of balance.
Yes. Basically, as I said, the sensory nerves are what are affected. And what ends up happening is the cells at the ends of the nerves actually start to die off. And so the nerve ending basically becomes deeper into the tissues. And that same thing happens on the sole of the foot. And so the nerve isn't down to the sole of the foot anymore, that it's a little bit deeper in. So you might feel like you're walking on a sponge or a piece of cardboard. And at the same time, what ends up happening because of that is that you're not getting that proprioception awareness of where your foot's at in relation to your body. And so you start to become dependent on your depth perception to maintain your balance. And so people that suffer with neuropathy, two things that I can tell you is that don't walk in the dark. and don't walk on uneven surfaces. If you've got throw rugs in your house, get rid of them, because in all actuality, there's a good possibility that just even having a throw rug, you may not pick your foot up quite as high as you thought you did, and you could actually end up tripping.
This is from Verna. She's in Scottsdale. She wants to know, she said, can you have numbness in your fingers and not in your feet and have neuropathy?
Yes, it is possible. But then at that time, what we also want to look at is a couple other things, because of the fact that you can have numbness in your fingers because of something that's actually going on in your wrist called carpal tunnel. And so we need to evaluate that. But generally, that would be the first thing that we'd want to eliminate, is the possibility that she's actually dealing with a carpal tunnel syndrome, where there's compression on the radial, medial, or ulnar nerve that's going through at the wrist, and that's causing that particular numbness. Most times when people start to have numbness in their fingers initially, it might be their thumb, their index finger, and just the inside portion of the middle finger. If that's the case, then generally what we're looking at is probably more carpal tunnel, because of the fact that there's pressure on the radial nerve at that point. And basically it's kind of like laying on your arm and having it go to sleep. That same type of thing happens.
Another text. Oh, this is a good one. My mother is coming in 3 weeks. I would like to make an appointment with her. I think from listening to your show, she has neuropathy. What do you do when you get a new patient to diagnose them with neuropathy?
Basically, we do a couple of different things. The primary test that we do is called the Toronto Clinical Scoring System for Peripheral Neuropathy. Basically, it's a sensory exam that was developed by a couple of neurologists about 22 years ago, one out of the University of Toronto, one out of Harvard. And basically, it's a test where we test for 7 different sensations in the lower legs and the feet, or that comparing how they feel there to a spot on the face. When everything is normal, you've got the same nerve endings up in your cheek that you do in your big toe, or you should feel everything the same way. If there's a loss of sensation, or if in some cases, if there's more sensation down in the feet, because what can end up happening is, as we lose some of the nerves that are there can actually become hyperactive and actually overreact. And that can actually cause an overstimulation when we touch it. So you may feel some things a little bit more. But that test, and then we also use a electrostimulus, basically like a TENS unit, and put that stimulus onto the hands so they know how they should feel it, and then try it on the feet. In most cases with neuropathy, people have it in their feet, they're going to lose the ability to actually feel that electrical stimulus.
What about diet? Do you change if you've decided that you've made that they have neuropathy? Do you change their diet at all?
Well, I make recommendations. I mean, here's the thing is that diet, particularly in the beginning stages, the diabetes is the number one cause of neuropathy. So getting your blood sugar under control is extremely important if you are diabetic. But the thing is that there's 199 other things that can cause neuropathy. The irony in this is that if somebody eats a high carbohydrate meal and they have their neuropathies from the other 199 things, that high carbohydrate meal, most chances are going to be that it's going to cause their neuropathy to actually get worse. The reason that diabetics develop neuropathy is that when we talk about high blood sugar, and I've mentioned this before on the show, the sugar is not just floating freely through the bloodstream, it actually attaches to the red blood cell where oxygen should. And actually, sugar has a higher affinity for that receptor side on the red blood cell than it does for oxygen. And so it actually blocks the red blood cell's ability to carry oxygen. Test that they run is called a hemoglobin A1C, and that number that you get is actually the percentage of receptor sites taken up with sugar where oxygen should be. And when that number goes up, basically the oxygen levels go down a corresponding amount. And that loss of oxygen is actually what causes damage to the nerves. And in people that have neuropathy, that they eat high carbohydrate meal, that loss of oxygen is going to just irritate the nerves for a period of time, and it can actually make their symptoms worse for a day or two afterwards.
Does neuropathy disrupt sleep?
Oh,
Dr. Sars?
yes. Basically, particularly, yes, it's one of the major things that most people will start to notice first is that they're getting disruption in
Mm.
their sleep. And the primary reason being is that as the nerves start to die off, as I said, we still have some normal nerves. So during the day, you've got your shoes and your socks on, and you're stimulating those normal nerves, and it overrides the abnormal sensation. And then in the evening, you take those shoes and socks off, and there's nothing stimulating the normal nerves that are there, and so the abnormal ones become more prevalent, and they start to fire on their own. Um, as those cells at the ends of the nerve start to die off and go deeper into the tissue, they will eventually just start to fire on their own for no apparent reason. Very similar to maybe what an amputee might experience with phantom pains in a limb they no longer have. And so during at night, there's nothing stimulating the normal nerves, so there's nothing overriding that abnormal sensation. So it becomes a lot more prevalent. For most people, that'll kick in around 2 to 5 in the morning, can be extremely disruptive in their sleep patterns.
Here's a text from Tucson. They said, I've listened to almost every one of your shows. If I miss one, I go to iHeart and listen again. I really like your show. What about, I don't understand when you say that you treat your patients' neuropathy at home. What do you mean by that?
Basically, neuropathy, as I said, is not curable. So the only way that we can actually give a long-lasting results is if people continue to keep treating themselves at home.
Mm.
And so we actually, people come in, they're actually purchasing a medical grade equipment to actually treat themselves at home. And then we do have follow-up visits in the very beginning, a couple times a month. And then once a month thereafter until they reach a point of stabilization. I'm available by phone 7 days a week from 7 o'clock in the morning till 8 o'clock at night, so that if my patients have a question that they can get it answered right then. What I never want to have happen is them to stop the treatment for a few days because they've got an appointment with me in a week and they'll just ask what's going on then. Much better to get it over with and continue to keep doing the treatment, because the only way this actually works is if they do it. And so I'm dedicated to what we do, and my involvement is there, and it's constant.
Norman wants to know: does Medicaid insurance cover this at all?
Unfortunately, no. The best that you're going to end up with
I said
insurance.
Medicaid. I meant Medicare.
Medicare, I understand, but it's still, in both cases, the answer is no. Medicare has at different times paid for different types of treatments over the 17 years that I've been doing this. And in the end, stopped paying for it because of the fact that one of the requirements that they've always wanted is that all the treatments be done in the office. And every one of these treatments, they're going to experience the same thing that I did. The reason that I was as naive as everybody else. That when I first started in 2008, we were doing all the treatments in the office. In 2015, during the summer, that we were a little bit slower, that my office assistant and I called about 200 patients that I treated in the 6 years previous to see how they were doing, and got told pretty much by all of them that they were as bad, if not worse, than they were when they first came to see me. Now, when we released them, they were good. So this told me I had a treatment that actually worked. It didn't last. And so if the treatment worked, then the only way to get it to last is if you're able to have the ability to continue to keep doing it as you need to. And so this is what we basically have gone to a home treatment protocol. And so new advancements in the technology that I use have improved dramatically to the point now that truly 98% of the patients that I've accepted do get better. And that's due to the fact that in the 17 years, I figured out who I can and who I can't help. But also because of the fact that technology has advanced to the point that most everybody will get better if they actually will do it.
What you've been doing this for such a long time, Dr. Sars. What are the demographics, male, female, age-wise?
The sad part is when I first started doing this 17 years ago, I was basically in my mid 50s, and all my patients were really old. They were all 70. or older. And now that I'm 70 or older, they're my age. But the sad part is that I actually starting to get more patients that are younger, that are in their 50s, 40s. Had one that came in that was in her 30s. And so something has actually changed over the 17 years. And this is part of the reason that, as you mentioned, that neuropathy has become more of a prevalent discussion now, is due to the fact that it's affecting more and more people.
What if someone does not get it treated? What could happen?
Depends on what the cause is. Somebody that is diabetic.
Does it get worse?
It gets worse. Somebody that's diabetic that doesn't get treated, amputation is actually highly likely. For the other 99 causes, what ends up happening is that people end up like my mom, that using walkers and wheelchairs, having a great deal of discomfort and pain, just due to the fact that their balance gets so compromised. And after a period of time, it actually can start to affect the motor nerves also, so they'll start to lose the strength. And so getting it treated is essential. It really is. The earlier that we can get it going on it, the better. That if we can catch people before they've got a 50% loss of their sensation in their feet, there's a good, the odds are we're going to get you back to 100% of normal.
Dr. Sars, I got to tell you, and I don't, bless you, I don't say this very often, and we do about 30 shows a month. You are such a wonderful speaker, and I am so glad that we have you doing this show. It's almost like you should have been a teacher, a professor in neuropathy. We are so blessed to have you. Tell people how they can reach you again.
Basically, my office is located in Mesa, Arizona, at Country Club in Baseline, that we're just a little south of the 60 on Country Club. My phone number is 480-556-1358. The website is isneuropathycurable.com. And I do answer the phone 7 days a week. Don't be surprised when you call. Outside of office hours, I am the one that's going to answer the phone. Basically, this is something that took me a long time to be able to find something that actually worked. And I do have it now, and I want to help as many people as I possibly can.
You are the best at what you do, Dr. Sars. If you missed the show today, you can go back to iHeart or you can go to Spotify. Dr. Sars will get back with us next month. And I just want to thank everybody. God, our numbers went way up for the last 2 months, and I really appreciate, because this is a great show. Dr. Sars, thank you so much, and we'll see you next month.
All right. Take care, Steve. Be safe.
Thanks, Dr. Sars.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.